What do we have here? What do we have on the screen? It may look like a tooth. To the patient, it may feel like a tooth or function like a tooth, but is it really a tooth? I guess if you look closely at it, you may see that a little old scar from an apico. The tooth is no longer there, but an old scar from an apico. But it's difficult to say that this is a tooth, or is this an implant, or really what is it? Well, it's an implant. If you look at the tooth next to it, or on the natural tooth, there's not many differences. They look the same, they feel the same, and they function the same. But really, what is it? And clearly, by looking at this film, that you can tell this is not a tooth. It looks like a screw. Doesn't it look like a screw to you guys? It looks more like a screw, something you would find at Home Depot, than something that you would see in someone's mouth. It differs significantly from what a natural tooth is. And what we're going to talk about is really an implant is not a tooth. Don't treat it like one. So let's really look and see what an implant is. Let's go back in time, ladies and few gentlemen. Let's go back in time to see really what is an implant and what the implant story is. It all started with this lovely guy with a bow tie. Many years ago, in 1952, he was doing a study on a rabbit, and looking at the blood flow in a rabbit's leg, they put this little titanium piece in the rabbit's femur, and then at the end of the experiment, after a few weeks, he tried to remove this little titanium piece, and he couldn't get it out. From that, they looked at it very scientifically and saying, what made this little device become so well integrated to the bone? And from that, in 1965, 13 years later, the first implant was placed in a patient. And as a matter of fact, she just recently passed away. So the first implant, root form implant, which we'll talk about in greater detail as it goes on, was placed in 1965 and survived the whole life of the patient. So 40 years in function. But if we look closely at an implant, it differs significantly from what a tooth is. It may look like a tooth, it may feel like a tooth, but it's not a tooth. So what is it? Let's look closer. Let's look at the interface between the tooth and the bone. If we look closely, what the difference is that the tooth, of course, has a PDL. The PDL is the ligament from the tooth to the bone and supports the tooth and helps with function. But what is between an implant and bone? An implant doesn't have a PDL. There is no movement of an implant. An implant is a distinct, different thing. If you look closely through a microscope, you'll see that the bone is closely in contact with the implant itself. And that's the difference, or the basic difference between the bone to implant interface, between the difference between that and bone to a tooth interface. Let's look at the soft tissue now that the implant emerges through the mouth. What is the difference? Well, the main difference is it's the way that it's attached. In a tooth, you have the PDL, then you have connective tissue fibers and fibers that go from the bone directly to the tooth. You have a connective tissue attachment, and you have epithelial attachment. That is on a tooth. But what is on an implant? You don't see really any of that. You have bone directly to the implant. You have a little slight epithelial attachment, and instead of fibers connecting directly to the implant, they go around the tooth. They do not attach horizontally into the tooth. If it's not a tooth, then what is it? What really is an implant? Let's think about it, and that will go and determine what it is, determines how we're going to treat it and how we're going to look at it much differently than we treat teeth. It's really a pontic attached to some type of an anchor. I don't know if many people discuss what an implant really is. That's all it is a way to attach a pontic at the bottom. And that's how you have to think of what an implant is. You don't see tissue like this around a tooth. This is though what you see if you had a pontic. Say there was a bridge that was from the central to the lateral here, essential to the canine, you'll see that the pontic which sits inside the tissue, and this type of tissue, keratinized tissue, forms along or around the pontic. So that's the main difference. It's really just an attached pontic. It's attached by an implant, but it's an attached pontic. So let's look closer at that.